let's start with measles because that's where this is. The title says measles, H5N1, and COVID. Oh my! In the 1950s and 60s, we would routinely have 500,000 cases of measles per year in the United States. And that was one of these ones where it was high, and then the vaccine came, and then it plummeted down to like tens of thousands of cases. And then, really, when they added the second dose in the late 80s or early 90s, I believe, it went from you'd have thousands of cases a year to just like a few. And we're talking to the point hundreds, maybe thousands, and then really zero for a while. And now we're back where we see before the pandemic, a couple hundred cases a year, a couple of years we had in the thousands. And now it's sort of creeping back. So we're having outbreaks. We thought we might be able to eradicate this thing, but we can't. So that's where we're at. Um, Let me start with Dr. Wallace. What do you sort of what people come to you and ask you questions? You're a science communicator and expert. What's the big thing that people ask you about this?
I think people are, so there's a few things going on, right? We know that we've seen data showing that vaccination rates across the board globally have dropped. We know that measles is, we call it the canary in the coal mine because it's so contagious that it's sort of a preceptor for other vaccine preventable illnesses coming back. And now we're seeing that. The questions I mostly get now is, do we need another dose of measles vaccine? People are nervous that they themselves are going to get measles. And so that's mostly been the questions that I'm getting, is just around whether people need another vaccine as adults.
Let me ask you, why do you say that measles is a canary in the coal mine for vaccine hesitancy? Because look, there's a lot of the pediatric child vaccine, the pediatric vaccine series, the sort of what everyone should get, has gone from nothing to
Yeah.
lots, and that's a wonderful thing. I mean, when we think about the preventable illnesses that we've prevented with this, but some parents are vaccine hesitant kind of
Yeah.
side of things. They, oh, it's too much. I don't want to do all these. Why do you think that measles is the canary in the coal mine?
Oh, just because it has more to do with the fact that measles is so contagious
Mm.
that that's the first one that's going to show up when vaccination rates go down. So that's the first one so we call it the canary in the coal mine just because it's an indicator of vaccine rates dropping before we start to see the other ones that are less contagious.
So yeah, I see what you mean.
It's
So
the
it's
first
it's it's
building block to fall.
Yeah,
right. And so yeah, right. So in other words, it's the one that's the easiest to spread and sneak
exactly.
by. I mean, the reproduction number of measles is like in the double digits,
Correct.
meaning that every single person who gets it, like obviously these numbers are depending on society and how many people you interact with, but like routinely a kid might give it to more than 10 kids in their classroom if they got it.
Hmm.
If they're unvaccinated.
Right.
Correct.
Yeah, it's like 90% of unvaccinated contacts will get measles from the one person.
Which is interesting because it's like it's different. We'll come to COVID. It's different from COVID in the sense of its incubation period being longer. So in that way, you have an opportunity maybe to stop an outbreak. On the other hand, it's just like an explosion of virus when when it happens. Dr. Jetelina, what are people coming to you with? I know you have a very active comment section on your newsletter. What do
I
people?
do. It's fun. I get so many more emails too. I agree with Kat. Like everyone's kind of wondering, those that are paying attention, if they need to the booster. We're not seeing that that's the case. Interestingly, I think after the emergency, I've been seeing questions like, is measles getting worse, or are we just more heightened aware now
Mm,
about infectious diseases? And in 2024, measles is coming in hot. And it is increasing. We're seeing a lot more sparks than we have seen before, which is concerning because it just takes one spark to find an unvaccinated pocket and spread like wildfire. Unfortunately, or I don't know if it's unfortunate, but I'm getting a lot of questions around politics and measles.
mm.
So, for example, where is measles coming from? Is it coming from the border?
Yeah.
That kind of stuff, which are great questions. I think we just need to answer them from a place because a lot of people are curious, and unfortunately, they're talking points of politicians. And I think that kind of wraps up the measles questions that I've been getting a lot of.
You know, you mentioned. Oh, go ahead,
No, I
Dr.
was
Wallace. Go ahead.
gonna completely agree with what she's saying about the origin being migrants, and that's what I've been hearing. We actually had an outbreak here in Chicago at at a couple of migrant shelters, and measles was already in Chicago when people came, and nobody arrived here with measles. This is an unvaccinated, vulnerable population, like we were saying, is that when we have those sparks, it'll find these vulnerable pockets of the community. And in fact, the CDC came to Chicago and vaccinated like 1,000 people in one weekend, and we haven't had any problems since. So it's that's exactly right what Caitlin was saying, is that it is not a problem with migrants bringing it. It was already here.
It's already here. And then also what we're saying, right, Dr. Wallace, is that it's actually US citizens going abroad, getting it and bringing it back.
The majority.
So the majority is from
Yeah.
travel, unvaccinated kids, adults going somewhere. Because in the globe, we have huge measles outbreaks. They get it and then they bring it back. And so I think that distinction is really important when we talk about um, equity and access and getting all the facts straight.
Yeah, and I also think that it's really important for people to realize that when you think about people coming to this country, we, I've seen this as a frontline clinician. People come here whether by official means or unofficial means, but especially people who are here extra legally, right, or outside the process. They're afraid to interact with the healthcare complex because they're worried that even a city hospital, which is supposed to be serving everybody, is going to call up like immigration and say, "Oh,
Right.
I found someone who's not supposed to be here." And so what I've always often seen is that people who came here, maybe they're dreamers or maybe they just came here out of just desperate need, don't then interact in a way that would really help them and everyone else. Like no one wants to spread measles, right? And so I always tell patients like, look, I mean, I work for you. Like I'm not, it's not my job to like, I'm not going to call like, anyone and tell them. And I wish we were just like, I wish we were just much more progressive on that issue. Like, and I see this just not to like hijack this, but I've seen this across the board in healthcare, like people who can't get dialysis because they're not documented. And it's like, this is crazy. Like we want to help everyone, and health is not the place to work out like our xenophobia. Like let's like please like take care of each other who's here.
And viruses don't
Right.
care
Yeah.
about, I mean,
That's
population health doesn't care. When we when we treat populations at a time, what it's all a team, it's a team effort. It's teamwork, or it's just measles is going to spread. So I think you're very right. That's really
Can we talk a
important.
little bit about specific things about measles that I think people don't get, which is this immune amnesia. And I know that Dr. Jetelina, you've talked about this a little bit, right? The idea that like I think people are worried that like, for example, COVID
yeah.
makes us more susceptible to other illnesses. And I'm not sure that's true. I think that COVID is a very bad disease to get.
Mhm.
But I don't, but it doesn't really attack the immune system's memory,
Right.
correct? The way that measles does.
Yeah. COVID doesn't attack the immune system, only a very, very small amount. I'll just say that. There's always a nuance there.
Right.
But yeah, measles does. And I feel like I'm talking too much, Dr. Wallace. You
Oh,
can jump
no,
in.
no. Yeah.
But yeah, I mean, measles does. And so what happens is you get a measles infection, it wipes your immunity to, for example, flu or to other vaccine preventable diseases. And a lot of people don't realize that. And so, yeah, you may survive that measles infection, but that we see higher mortality after measles infections to other things because of that reason.
Okay.
Yeah, I agree to Dr. Faust about how people have been saying that COVID then destroys your immune system and goes. I think we have data to support that in long COVID, and we have data to support that in certain special populations that there's some immune kind of deficiencies afterward. But the general public walking around like that have had like a mild case of COVID, I don't know that we have data to support that there's immune dysregulation in the general population.